Hello and a very warm welcome, viewers. You're watching the brand new edition of To The Point with your host, Kriti Mishra. And on today's show, we have a very special guest with us. Joining us on the program, Member Health, NITI Aayog, and the head of India's National COVID-19 Task Force, and in charge of key empowered groups on India's emergency management plan and strategy and vaccination, Dr. V.K. Paul. Dr. Paul, welcome to Sansad TV, and thank you so much for joining us.
Thank you, Kriti. It's a pleasure and honor.
Thank you so much, sir. Well, the COVID situation in the country appears to be stabilizing with decline in daily active cases, and the positivity rate is also coming down. Sir, is the second wave coming to an end, or is it too early to say that?
It is evident that there is a consistent decline in new cases, practically from all the states, but there are districts which still continue to have high test positivity rate. That means pandemic is in a way localized here, but overall, yes, indeed, the second wave is now on a decline and a rather fast decline in a way. But point is that this is happening because we are imposed significant restrictions in most states. So we must remember that when we go to de-restriction phase, we have to be very careful. And then in addition, we are also exhibiting a responsible behavior, all of us, by avoiding crowds, not mixing, partly because of restriction, but even otherwise. We become more conscious about wearing masks, for example. We know that we are now more compliant. And also the government machinery in terms of pandemic control and vaccination escalation, there is a comprehensive effort behind it. And so it is not as if the virus has decided to finally say goodbye to this nation, but it is because we have taken measures in a very comprehensive sense to suppress the chains of transmission. But nonetheless, yes, it is heartening that things are under control, things are settling down, and we can think about opening up in a certain responsible way.
Sir, as you're talking about opening up, as states are moving towards unlocking localized lockdowns, as you said, towards normalization, what is your biggest worry at this juncture?
My biggest worry is that this stage should not be seen to be a point where the guard can be lowered. We could be visualizing a false sense of relief, confidence, overconfidence. That should not happen, because that's why I preface this whole discussion by saying what you are seeing is as a result of efforts. It is not spontaneous. It is not that the virus has decided to go away forever. No, it has happened because we are careful, we are responsible, we are compliant with COVID appropriate behavior, we are ready in more than one way to look after positive cases and hospital readiness, containment measure readiness, high level of testing, and so on and so forth. So it's a mix of everything that has made this possible. So the worry is, A, that we should not be complacent and assume yet again that the virus has gone away forever. And that applies to us also in the system, that our system preparedness, containment and surveillance preparedness and implementation cannot be slackened. And therefore, the worry is that we should not lose ground to the virus. That's my first worry. The second worry is that we have to be careful that we are watching the behavior of the virus in terms of mutants, in terms of change in the characteristics of a virus for worse from our point of view. And also my concern is that we must move forward with continued responsible behavior, particularly wearing masks in an optimal sense. And we should remain responsible.
So we can't let our guard down, and of course we can't be complacent, sir. But sir, another important aspect that I'd like to touch upon is the fourth survey, the Sero survey. The first to be carried out after vaccination has been made available to the general public. What have we learned from the Sero survey so far, and how would the latest findings shape our strategy against the pandemic, sir?
Well, the last zero survey, the national one, was in December, January, as you know. We are now going forward to a new zero survey, hopefully starting this month by the Indian Council of Medical Research. And that would be very important in terms of our understanding of the extent of the disease, extent of the pandemic, and also distribution by age, etc. And that will then help us plan on a macro level how to foresee the outlook of the pandemic and how we can best respond to it. The last zero survey showed us that overall, about a quarter of Indians had harbored the virus at some point, and those antibodies were there in about a quarter of people, which also meant conversely that three-fourths of people of India were still vulnerable. And that is why, when the virus got the chance, it struck and it struck heavily. So remember, what the zero survey would tell is what is the extent of vulnerable individuals who are still susceptible, who form the susceptible pool to which the virus can attack. And therefore, it will be very useful. But remember, you reduce your susceptibility either by experiencing the disease or illness or infection, or you reduce your susceptibility by embracing the vaccine. And we are fortunate that we are moving pretty much well with vaccine scale up. We are fortunate that we have indigenous vaccines in significant amount and rising amount available to us for inoculating our large population. And this bodes well for future. And it is much better to achieve uh, immunity and immune protection, and eventually, hopefully, large scale immunity that we call as herd immunity through the vaccine rather than through the illness. And therefore, it is critical that we look at the next zero survey to design the effort and fine tune our effort.
So you talked about herd immunity. Now, there is a raging debate on herd immunity, different perceptions, different opinions. How far is India from herd immunity?
This answer to an extent would be available after the zero survey because our last zero survey was before the second wave. And the second wave has been very, very significantly more intense in a shorter period of time. And therefore, let's wait for that zero survey to indicate this to us. But remember, what is the level that is safe for us? We don't know. I heard that there is a zero survey in Ahmedabad that is showing 70% people already have antibodies. We had a zero survey in the city and the state of Delhi, which showed that 56% odd had the infection, but then we had a devastating wave in Delhi. So I think it is a good notion to discuss and to think about because it is essentially valid. It is a high epidemiological principle and therefore it is valid and we must continue to look upon it. What we do not know is what is the level that is safe for us as a society, as a community, as a nation, as a geography, as a population. That's something which is truly not known. You are aware that in Brazil, there was one particular city, there were 70% people who were so-called immune, and then the P1 variant that came there had a devastating outbreak out there. So we really do not know. I think our way forward is that we must buy time, be responsible, be careful in implementing and perfect in implementing the containment surveillance testing strategy and buy time. And during that time, scale up the vaccination. So if we can somehow buy 5 to 6 months, keeping the virus low, keeping the cases low in all parts of our country, and then scale up the vaccination. That is what is the most desirable scenario that our nation should hope and strive for.
Sir, you are talking about scaling up vaccination now. In a significant decision, Prime Minister Modi has announced a centralized vaccination drive. Government of India is also working with vaccine manufacturers, financing them. We are set to expand our vaccine basket as well. So going ahead, how many doses do you think we'll be able to administer per day?
Kriti, this is the imperative is that we have to cover those individuals for whom the vaccine has been tested and has been recommended. Currently, this is so for adults 18 years and above, which is about 94 crore people. And if you are typically going with two-dose vaccine regimen, then you need about 188 odd crore uh, vaccines to be given. That's a huge task, but then we have to accomplish this. We have to go back to normal times, normal socio-economic activities and life and way of life the soonest possible to get over this pandemic, hopefully once and forever, in terms of warding off the virus. And then, if there is a little bit of endemicity of the virus, we can live with it and live with it with the protection available to us to a large extent by the jab that you may have received. So, that is the goal toward which we would like to work. And we do believe that in order to provide so many vaccines, the way our stockpile production is increasing, the way additional companies are joining hands in terms of their produce being available for actual implementation, going beyond their current state of development in certain cases. We do hope and believe that it is possible for us to undertake that activity in the next 7 to 8 months. It's possible. There are some unexpected or unknowns, but that's okay. When you plan both with pragmatism, but also with hope and optimism. So we're trying to strike that balance. And having said that, yes, as the production and supply becomes better and better and better, our speed of vaccination also has to become better, and then much better in one go. And therefore, a time would come when a very large number of vaccination numbers and vaccination activities would be going on. And you know that currently we are clocking about 30 lakh per day for the last few days now, consistently. We have crossed 25 crore doses yesterday. But clearly, this will elevate in times to come. And that's what we propose to do. I don't want to put any number per se, but clearly one can do such estimates. What is important is that what we want to achieve nationally gets disaggregated as achievements at the state and the district level. And when you visualize that, then suddenly things look possible because in a community of 5,000, you only have to give vaccine to about 3/4 of the people, which is then numbers become sensible. So this country has a challenge, but it also has resources. There are people available on the ground to be able to mobilize. People are available to vaccinate. The critical factor is truly generous supply of the vaccine, which we hope is now building up. And going forward, we can hope and positively, and we can be optimistic.
Absolutely, sir. Fair enough. Given the size of India's population, it's a Herculean task. But sir, since you were talking about that particular age bracket, how soon do you think that India will be able to vaccinate its children? We understand that clinical trials are underway, but what are the timelines that you're looking at, sir?
It is not fair to put a timeline at this point in time. The reason is that the that we have to, going by the data and scientific evidence and practice and experience, we need to go up to 12 years of age. Below that, right now, no country is doing it. No trials are available for any vaccine. But up to 12, yes, some vaccines have been now allowed and some countries have taken that forward. For us, the challenge would be that we are not dependent on the vaccines which have already been certified for this age. Even if they come and we are trying to get those vaccines, their number cannot be not expected to be such a large number that we can think about vaccinating every child between, let's say, 18 to 12 using those vaccines. And therefore, we need to wait for a while to have the results of our two vaccines, trials of the two vaccines being available. And I guess it is a matter of a couple of months. It's not something which will take much longer than this. So the Zydus vaccine and the Bharat Biotech vaccine both are now covering children up to the age of 12, and in fact, one of them going below that. And let's wait for it. And once we know that the vaccines are safe in children and also effective in children, there will be a way forward. But meanwhile, let's push the effort to cover the current eligible population with particular focus on those who are above 45 because they deserve the vaccine first and foremost. And that's how the government had taken the journey in this regard because of the high potential for adverse outcomes in that group. So it's a staggered process. Nobody started with children.
Yes.
Practically nobody started with young people. Practically all the nations started with the elderly, and they decided to go prioritize. And once the vaccine availability shot up in those nations, these groups were covered, then it was opened up, and we are now in that situation that we have also opened up. And therefore, the crucial responsibility that we have now is to make sure that the vaccination hesitancy does not take roots again, please. You see, right now there is eagerness because we have just witnessed a wave where everybody was then, clamoring for cover, so to say, saving yourself. Uh, but going forward, we must not fall in the trap of hesitancy once again. And that is a very important part. And therefore, a positive narrative, faith in the vaccines, and scientific, truthful communication is the way forward, where institutions like yours and other media colleagues have a very important role to play. We must align as a to this national mission. There will always be little nuance, nuancing that you may like to see, somebody may like to see, but please, on the broad bandwidth of our understanding and the way forward and the strategy, we must align. And we need it urgently because we lose time. And once the supply becomes better and better, it is our responsibility to persuade more and more people to embrace the vaccine. It must include people from rural areas, urban slums, rich, poor, everybody. And we would like to ensure from now onwards that vaccine hesitancy does not step in. And at the same time, uh, over sort of restlessness to see things happening in one day, 1 week also should be avoided. Remember, no nation has achieved, no big nation has achieved vaccination coverage of the entire country, let's say. Um, Most have actually not even achieved the coverage of the entire population, but a significant coverage in a matter of days or weeks. It takes months. And we are on that journey, and we will be able to achieve our goal for sure, but little patience. Secondly, making sure that there is no hesitancy when we are targeting to people, populations, housing societies, and so on, and villages and communities. Hesitancy should not come in the way. And a gentle wait for your turn is also very important. And gently telling that somebody above 45 must be prioritized against somebody who is 25 as a voluntary effort. It's open now, but से पहले इनको लगने का ठीक है. तो ऐसी ऐसी भावना से ही जाके हम कंप्लीट कर पाएंगे. ये तो स्टैगरिंग पॉपुलेशन है देश की, आसान नहीं है, लेकिन होगा ना, करके दिखाएंगे, सब मिलके करेंगे.
Dr. Paul, that inspires confidence and optimism. And sir, you were talking about responsibility. Well, Sansad TV has been constantly propagating the messages imperative to fight the pandemic. But sir, a lot has been said about monoclonal antibodies cocktail. What is your take on it?
The monoclonal antibodies are specific antidote to the virus. There is a particular type of antibody combination which seemingly has worked. There is evidence that it is effective. There is another particular one which is not so effective. But the fact remains that this modality of treatment, in principle, can help avert progression of disease if given in early stage. So it is something which is given early so that the disease does not progress beyond a particular level of severity and you recover. It doesn't go further because it neutralizes the virus. Remember, one, it is not a choice between vaccine and monoclonal antibodies. Vaccine is a real prevention. Okay? And monoclonal is when somebody has got it and then you're trying to protect yourself. It's a very costly, expensive drug for sure. It has been allowed for import into India now. And it is available. Yes, it has a place and it can be given under certain circumstances, particularly if there are significant comorbidities. In that group, one can try to do it. But remember, this is really not something which is a must drug, so to say, for multiple reasons. One, it's a scarce drug. It's to be imported. It's very expensive, and then it just serves a part of the purpose. It is, it is much better for us to take precautions, much better for us to wear the vaccine and avoid the disease altogether.
So this is an uncharted territory and we are traveling through an unperceived threat. We don't know how the virus is going to behave, whether we'll have the third wave, the fourth wave, or the fifth one. How well equipped are we? How well equipped is India now to fight the subsequent waves?
Firstly, whether to have a third wave or not is in our hands technically. Because if we remain responsible, if we create the fine balance between continue to have activities, livelihoods, and yet be responsible in terms of individual behavior, which means individual practices, particularly mask and social distancing, and also increasing uptake of vaccine. That's individual. At the same time, if we are responsible in terms of containment, surveillance testing, test, track, and treat strategy, optimal, which would also include that if there is a cluster of cases in certain locality, that locality becomes a micro-containment zone. There is a quote-unquote lockdown for that area. Not easy to administer for a period of 14 days, 21 days, and so on. Then we don't allow the virus to cross the limits of this geography. So if we continue to enforce these principles, which we keep repeating, but I keep repeating in particular, then why should there be a third wave? There need not be a third wave. Even if the virus strikes, we suppress. We don't allow it to go out of hand. So third wave is truly technically and epidemiologically and in terms of experience is in our hands. Okay. And also in particular, even if the virus resurges, let's say in a district or in a state, if we act early, we suppress it back again. We don't allow this to become a curve like this. Okay. Having said that, please remember, this virus is very smart. This virus then changes its characteristics. It changes its face. It brings in new shape, a new variant. And a variant could be smarter than the first one in terms of transmissibility, in terms of severity. We don't know. So this is that unknown X factor which you cannot plan for. The only way to finish the chain of new variants to happen is to suppress it so severely that there is very little multiplication of the virus going on in this planet, not in one area, because wherever it happens, it can travel wherever it can travel. So remember, that is the unknown, which is really in nobody's hands, except as a collective effort of the entire humanity, that the replicating viruses are minimized. Less number of replicating viruses, less possibility of a mutation. And you cover with vaccine and protect yourself and buy time. So the 2 points that I'm making here is one, remember that we can avert a third wave by being very responsible, scientifically valid pathways toward protection. And disease suppression, chains of transmission suppression can avert and should avert, and we should resolve that we will avert. When we say we will avert, then it is district level. Don't allow positivity to go on. Act early. Have high levels of testing done. Go for micro-containment zones. Enforce COVID-appropriate behavior. So don't let it happen. If it happens in 30 districts, it happens in a large geography. It happens in 300 districts, then you have a national wave. Why should we allow this to go out of hand, right? Second part is remember and pray to God that the X factor of virus mutations hopefully will not happen. Because if that happens, then the virus then needs a very different kind of effort and can fox some of our efforts. But the fact is that even when there is a new mutation, what do? You again play with the same tools that I've emphasized, except that for a while we'll be taken, on the back foot, but then we will respond exactly with the same tools. There are no other tools. It is testing, it is surveillance containment, it is COVID appropriate behavior, it is treatment, it is vaccination, it is restrictions. Can only play with the 6 cards, and therefore use them judiciously from now on so that that does not happen. And if it starts to happen in a particular population geography, act fast. Don't allow this to go to larger geography, and hope for the best.
All right, Dr. Paul, before we sign off, just very quickly, sir, you've been steering India's efforts against the pandemic. What is the biggest lesson that this pandemic has taught you, sir, personally?
Well, it has taught the power of science and investment in science, cutting edge laboratories, promoting science through research and development where industry comes in, and investing in scientific mindset and capacity. That means our training, our competent people in specialties, epidemiology, infectious disease, clinical care, science is the big learning, and it is science that's going to defeat this virus. Thank you.
Absolutely, sir. On that note, thank you so much for speaking to us, sir, and all the very best for your endeavors. And we do hope that we emerge victorious against this virus very soon. Thank you so much, Dr. Paul.
Thank you, indeed. Thank you very much.